Here today, I had a great discussion with a local personal trainer that is about to start working with a patient of mine. I'm seeing this patient for back pain, and I was helping them create the training program that this client is going to be partaking in. And we were discussing squatting. Now, squatting is an extremely common movement in the gym. I'm sure you have performed it yourself. And I was discussing with the trainer as to why this particular person should not be performing back squats. And to some people out there, the folks who really like to get after it in the gym, this may seem like the worst thing you've ever heard. And I'm not here to say back squats are bad. However, every exercise carries a risk versus reward ratio. And when it comes to a lot of our folks that have back pain, back squats can be a little bit more challenging. And the reason is because the weight of the bar when we back squat is behind the head. And when the weight is behind the head, it pushes our center of mass forward, making us more likely to go into positions that result in a great deal of lumbar or low back extension, resulting in increased compression of a lot of the joints in our lower back, and actually can result in positions that restrict movement at the hips. And when this is the case and we add the increased extension that equals that compression combined with the weight of the bar on top, all that compression loading going directly into the spine can be uncomfortable for a lot of people and over time create some issues. So, if you are one of those people that have had a history of back pain and you're just looking to find the safest, best ways to train, sometimes the exercise choices are the best things that you can modify. And in these cases, maybe back squat isn't the best choice and you should resort to something where we're perhaps loading more in front of the body, such as a goblet squat or a front squat, or even one of my personal favorites, a safety bar squat, because when the weight is now oriented in front of the body, it allows us to shift back a little bit. It allows us to feel our abs a little bit more effectively, opens up the hips a bit more, and shifts load away from the spine, which allows us to squat in more back-friendly positions. And even though we're not back squatting like we all see in the gym, we can still load those legs a lot. And in fact, when we're not using our back to hold us up, the legs are doing even more work. So you may find that those legs really catch fire a lot quicker than you might expect. So if you're somebody who likes to get after it in the gym, but you have an injury that may be holding you back, or maybe you have a history of an injury that you're worried about re-aggravating, all it may take is a little modification of an exercise, just like we discussed with the back squat. So whether you're looking to pack on more muscle, increase your strength, maybe you want to increase your bone density, contact us. We can help you determine what the most effective exercises are for you to perform to reach your goals without getting another injury.